Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the government is not apologizing on how it responded to the COVID-19 pandemic. Malacañang maintains that authorities have done an excellent job managing cases before the surge in March. Also, OCTA Research experts warn the number of new coronavirus cases per day could reach 11,000 by the end of March. And the government is eyeing to achieve a stable supply of vaccines by April. Senator and Philippine Red Cross Chairman Richard Gordon joins us live. One year ago, our lives completely changed as the government placed Metro Manila under a strict enhanced community quarantine. What has happened since the start of that lockdown until the rollout of vaccines this year? Our senior correspondent, Ruth Cabal, takes a look.
Metro Manila ground to a halt when the government imposed the strictest lockdown on March 15th, 2020. In 48 hours, the enhanced community quarantine covered the entire Luzon and restricted the movement of around 57 million people in 8 regions. Public transportation was suspended. Construction projects stopped. Schools were closed. Non-essential businesses and services stalled. More than 7 million Filipinos went jobless as the economy took a major hit. To help struggling Filipinos, the government approved a cash aid to 18 million households for 2 months. After a strict lockdown, a number of provinces were allowed to relax restrictions in May. And some businesses and services reopened. But by this time, the pandemic brought the economy to its knees. Economic managers declared a recession as the economy posted its sharpest decline since 1984. Meanwhile, the healthcare system was on the brink of getting overwhelmed. The World Health Organization flagged the Philippines for having the fastest spread of infection among 37 countries in the Western Pacific region. Despite the coronavirus threat, the administration began further relaxing restrictions by the third quarter. But the health sector pleaded for time to regroup. ECQ was extended, including in Metro Manila. Later on, downgraded by a notch. The country reached a grim milestone in coronavirus cases, 100,000. It also registered the highest infection in Southeast Asia, as cases doubled in August. With the raging pandemic, Filipinos struggled to get back on their feet. Over 73,000 online businesses registered with the Trade Department at the onset of the Christmas season. There was a spike in e-commerce, such as food deliveries, as people shifted to online purchases while staying safe at home. In the meantime, the struggling tourism industry saw a ray of hope as destinations began reopening in October. Thousands of Filipinos were able to get jobs again as unemployment substantially declined. With the world racing to roll out vaccines, Filipinos welcomed 2021 with hope. On March 1st, the country finally began to boost its chances in fighting the coronavirus pandemic by administering vaccines initially to medical frontliners. While a number of Filipinos still need convincing to take the shots, at the end of the day, immunization is an effective defense against a deadly, unseen enemy.
And let's go straight to the source of the story. We have Senator and Philippine Red Cross Chairman Richard Dick Gordon. Senator, good to see you again. Welcome to the show.
Thank you. Always good to see you. Hello
Senator,
to everyone.
Yeah, there's a number of really topics I wanted to discuss with you. First, let's talk about this, the COVID cases. We're looking at what, 4,000, 5,000 cases per day the past couple of days. Secretary Duque, during an interview, said this is alarming. How do you assess the situation? That's what I wanted to get from you. Why are we seeing the same numbers as we did in August of last year?
It's even getting higher than August of last year. I expect that this will go up to 6, maybe 8, and later on 10,000, unless we do something we ought to have done a long time ago. I think we wasted in 5 weeks, 5 days, what we've been able to successfully do in 5 months. We were able to bring the statistics down. Unfortunately, we got overconfident. People started going out, and there were no restrictions. And I think the first thing that we ought to do is require everybody to wear masks when they go out, and make sure that the jeepneys and the buses are loading the right number of people, and make sure that everybody's washing their hands. And especially when they eat, they should not eat together. They should not talk while they're eating when they're together. And even we're not prepared even with the workers who are going to work, because there's still no housing for them in the workplace. At the very least, they should have a tent so that they won't have to go back and forth and catch the disease again.
Wow, that's a lot. And truly, a number of the things you said really hold true. I just want to go to what you said even about transportation. We have what? Of course, we've opened the economy. Senator, sabi nga nila, yung GCQ, MGCQ, ECQ. We are currently on GCQ, but even government says, really, we're really almost on MGCQ, which is the lenient status. But even sa transportation, when you look at reports or talk to people on the street, sinasabi nila, kadalasan, hindi na din talaga natutuloy yung sa mga public transport, yung sinasabing dapat a number of passengers sa loob ng jeep o sa loob ng bus.
Well, kaya nga dapat may linya yung mga jeep, may linya yung mga bus, at saka yung linya, layo-layo sila. At pagkatapos dapat talagang binabantayan kung meron silang dalang mask o mga... Ako nga gusto nga, bigyan sila ng sabon o alcohol na maliliit para palagi naguhugas ng kamayan. No? But at the same time, yung mga lockdown areas, yan ang kinakabahan rin ako. Pag nag-lockdown ka, hindi makakalabas yung tao. Paano kakain yung mga yun? Lalo na't marami nang nahihirapan dahil hindi kumikita. So kami sa Red Cross kaya, na pinaplano namin, magde-deliver kami ng pagkain doon sa mga lockdown areas para sa ganun, hindi na sila lalabas para makasapat sila sa pagkain. Pero unfortunately, yung plano ng gobyerno medyo urong-sulong eh. So, halimbawa, we could stem the tide of this testing sapagkat unang-una, ang binabayaran lang ng PhilHealth, yung tinatawag natin swab test. Kami pa ang pinakamura dyan, 3-4. Pero naglagay kami ngayon nung saliva test, which is 2,000. 2,000 lang. Ang government natin, yung HTAC, yung Health Technology Assessment Council, ay hindi kumikilos. Magmula pa ng October namin PhilHealth yan. So hindi mababayaran ng PhilHealth yan. So ano nangyayari? Doble gastos ng PhilHealth. So pwede lang bayaran ng 2,000. So mas maraming matetest. Kung konti ang matetest mo, hindi mo mahuhuli yung mga nagkakaroon ng COVID at ang mangyayari, talagang kakalat talaga yan.
Which exactly is where I wanted to go in terms of testing sa Red Cross. But I have to go, I'll go to that a little later, no, Senator. Testing, obviously very important. But sabi mo nga, we lost what we gained in the past months in 5 days. Why? Why exactly? Is it? Are you talking about what? Yun hubang nag-umpisa na yung lockdown sa Pasay from a number of barangays, umabot ng 70 barangays, and yet, it still kind of took a while before such, siguro, stricter measures were imposed. Is that what you...
Pag tinignan mo yung statistics, nagsimula sa 2,800, tapos bigla sumampa ng 4,000, dapat nagulat na tayo. Tapos umabot na naman ng another 5,400 in March 15, March 14, 4,300. Makikita mo, March 13, 5,000. March 12, 4,578. So umakyat na, nag-iba na. So dapat kilos kaagad. Ano maling ginagawa natin? Dapat, siguro kailangan natin mahigpit sa mga sasakyan. Dapat siguro staggered working hours. May papasok ng alas 8, may papasok ng alas 10. Uuwi ng alas 10 yung alas 10. Uuwi ng alas 8 yung alas 8. Mari natin sabihin ganyan, no? Pero tila... we are reactive. We're not really having a game plan. Tulad ng ibang bansa na talagang babantayan natin ang takbo ng statistics at malayo pa makikita na natin yan. Now, hindi variant yan. Hindi ako naniniwala ng variant yan. Naniniwala ako, lax lang talaga ang mga tao. Kailangan turo ng mga tao. Sa akin, kung ako masusunod, lahat may face mask. Hindi ko pwede lumabas sa kalye na wala kang face mask. Pag wala kang face mask, huhulihin ka, makwa-fine ka. Kung di ka naghuhugas ng kamay, wala kang baon na alcohol, huhulihin ka dapat. Para malaman ng tao, proteksyon nila ang hinahabol natin.
So, Senator Joel Villanueva was saying we are back to square one. Do you agree? I guess.
Not really, because marami na tayong natutuhan. Marami naman nabubuhay doon sa mga ospital. At hindi pa naman talagang sabog na sa ospital. Maraming napupuno, pero yung mga COVID, ang tinitingnan ko, meron mga 40%, may 60%. Ang nakakatakot dyan pag napuno ang ospital. Saan ka tatakbo? In fact, right now, ang problema ng gobyerno ngayon, sayang ang pera eh. Ang mga pera natin, ginamit natin, ikina-quarantine natin sa mga hotel na binabayaran ng gobyerno. Pwede namang dapat mag-discount yung hotel o dapat mag-contribution na rin yung OFW ng konti because kaligtasan nila importante at ang gobyerno merong ibibigay na tama. Pero ngayon, nag-gastos na yung pera. Ang sabi ng OWA, wala na silang perang maibigay.
Right.
So magkakaroon tayo ng problema ngayon. Pati ngayon yung mga barangay, kailangan dagdagan natin ngayon ng mga quarantine areas sapagkat kakapusin yan. Ang una naman dapat gawin, talagin natin, pag ikaw ay nag-COVID, ano dapat ang gawin mo? Ni yun nagugulat yung tao, hindi nila alam kung anong gagawin nila. Akala nila, pupunta na sila sa ospital. That's why in the Red Cross, we have 1158 para sabihin sa'yo, hindi pa masyadong seryoso yan. Kung may quarantine ka sa bahay, mag-quarantine kayo sa bahay, huwag muna kayo lalabas. O di kayo naman, pagkakailangan na, tumawag muna kayo, kukunin kayo namin kayo ng ambulansya, makikipag-coordinate kami sa ospital para hindi masyadong madadarang yung ospital.
But Senator, in a sense, what do you think? Sabi niyo kasi reactive ang gobyerno. What should the national government do? And another thing, siguro to follow up on that is, pakiramdam niyo ba merong sense of urgency on the part of the national government, seeing that the cases were starting to rise?
Meron naman siguro, pero kapos. Hindi talaga nabubuhay yung sense of urgency na talaga magwa-warning ka na, mag-a-announce na sa publiko lahat, yung mga sound tracks natin, o mag-iingat kayo masyadong labas na labas, tumataas ang one, at magdadala niya kayo rin. Kaya dapat nagpa-test na ba kayo? Ayan. Kayo ba ay may mask? Yung mga ganun. Para ang tao, palaging conscious. Kasi pag hindi mo pinagsabihan ng tao, gagalaw yan. Nakita mo ng Pasko, kaliwat kanan doon sa Divisoria, tabi-tabi. At hanggang ngayon, nakikita natin, marami sa mga sasakyan, punong-puno. Hindi dapat yon. Kaya nga sabi ko, dapat may staggered hours, pag-isipin yan. At dapat talaga maghanda tayo ng mga tents na bago para yung mga maka-quarantine may pupuntahan.
Okay. Government earlier said that government is doing an excellent job in terms of addressing this COVID-19 pandemic. What are your thoughts on that? Are they doing that?
That's the worst mistake the government can do is say, we're okay. We're not okay. Tumaas At huwag na natin hintayin mapuno yung mga hospital at magkamatay yung mga tao. Kaya kailangan paspasan ang testing, paspasan ang vaccination. Nahuli tayo sa vaccination ng konti, dapat paspasan yan, humabol tayo.
Senator, we need to talk about the testing and the vaccination, but we need to take a very short break. This is The Source on CNN Philippines. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Senator Richard Gordon. Senator, first, I just want to go to the OCTA projection. You know, in the beginning, sabi po nila, Senator, we could reach 6,000 by the end of March. They revised that to 8,000 by the end of March. And then now, they're looking at a possible 11,000 by the end of March. What kind, do you think this is really possible? Especially, we were talking about yung positivity rate sa testing sa Red Cross. And paano kung mabot talaga tayo ng 11,000?
I agree with Dr. Dapat talaga pag-ingatan. Kasi kung di mo tatakutin ang tao, alam nyo, ang pag-asa ng bayan nasa tao. Kung di tayo maglilikot, di tayo maglalagay ng mga mask, talagang tatamaan tayo. Makikita naman ninyo sa Red Cross sa Talaan, nakikita mo, nagsimula kami ng March 1, 7%. Usually, before that, we were at 4%, 5%. Ngayon, 7%, March 2, tapos March 4, umakit na 9%, bumaba na 6%. Ang dalawang araw, then umakit na naman 8, 9, 8, 9, 8, 8, 11% on March 13, 8% on March 14, on March 15, 9% on March 16, 11%. Hindi kami umaabot ng 11% or even 9%. Dati 4%, 6% kami. Mataas na yan. So, talaga ako, kinakabahan ako dyan. Dahil pagkat hindi tumigil yan, that means dumadami pa. And alam mo, the government is caught between the devil and the deep blue sea. We don't have to close everything naman eh. Dapat lang talaga, pag itingin yung paghihigpit, I don't want to sound simplistic, pero pag nakamask ka, may protection ka. Pag naguhugas ka ng kamay mo every 15 minutes, meron kang alcohol, maliit na gastos yun. Kaysa naman matataranta yung buong pamilya mo pagka nilalagyan ka na ng mga swero at saka yung sinasaksakan na yung lalamunan mo ng incubator. Importante malaman ng tao yan. Kulang tayo dyan. Ang tao nagiging overconfident because marami sila nakikita na gumagalaw tayo. Pero hindi naman masamang gumalaw. Basta maglagay ka lang ng mask at maglagay ka talaga ng pag-iingat. At pagka ikaw hindi naglagay, the government should start fining people.
Senator Amy Marcos, I think yesterday Senator said that she wants an overhaul of the IATF. Do you think dapat ho bang i-overhaul, palitan ng konti, i-modify?
I think they should consult the public health sector more, and I think they do that. I think General Galvez is doing a good job. He's a salesman. He goes to India. He has to look at the statistics. He needs a bunch of people, and I think he does have that. Venus Dixon is doing a lot of good work as well, but they need more doctors, public health especially. We have UP. We have UST. Ang dami natin pwedeng tawagin dyan. Tulungan nyo kami dyan para maayos natin. Let's have regular meetings, monitoring teams para alam natin ang gagawin. I don't think that's happening. Kami nga sa Red Cross, hindi kami tinatawag eh. Tatawagin lang kami. Katulad kahapon, sabi, pwede na ba kayong mag-vaccination? I've been waiting for that. We can vaccinate and help the vaccination test increase. We've been vaccinating for polio and for measles. Kaya namin mag-vaccinate. Hindi naman kami mga knight in a shining armor, but everybody should help. That's why, Pinky, nananawagan ako sa mga lahat ng doktor, lahat ng nurse, lahat ng student nurses, student doctors na mag-volunteer. We're forming a medical corps na talagang walang gagawin kundi mag-vaccinate. May kanya-kanyang duty araw-araw para makatulong sa vaccination.
Senator, help us understand the situation. We have vaccinated so far 215,000 in 2 weeks. Nakausap ko po si Senator Ping Lacson last week. At that time, we were looking at 115,000 vaccinations in 1 week. So he computed this. Parang lumalabas, if we stay on this pace, that 115,000 in 1 week, it'll take about 11 years, he said, and 8 months bago po ma-achieve yung tinatawag nga na herd immunity. Masyado ho bang mabagal ang ating vaccination, or these are really the siguro the birth pains?
Growth pains. Growth pains. I think Senator Lacson as well, when he says, kung ganyan, babagal tayo. So that pushes a high octane sense of urgency on our people who will vaccinate. Pero ilan ba yan? Dapat lahat ng bayan covered na, lahat ng health stations covered na. Marami naman tayo, meron tayong health system, andyan ang Red Cross, andyan rin natin makukuha sa mga private sector. Once we start going there, I think the vaccination will increase. Ang problema, yung distribution. We have to be quick in distribution. Dahil yun, pagka kinapos, bakante. Kailangan naka-schedule na yan at susundin yung schedule. You have to run it like a freight train na tuloy-tuloy may oras.
And when you talk about testing, of course, Red Cross has been at the forefront of testing very recently. Well, I would say siguro, Senator, a month and a half or 2 months ago, pinayagan na nga yung saliva testing. In fact, I remember speaking to Secretary Vince Dixon, sabi niya, ang allowed dapat ngayon, RT-PCR na swab or RT-PCR na saliva, which the Red Cross, and I know you have a drive-through somewhere in Mega Mall, ano po. Sabi niyo 11% positivity rate. Has the number in the past months decreased in terms of testing? Because I want to find out if that could have been the problem. Maybe we're not really just testing enough people.
That's the point. We're not testing enough. Sabi mo sa isang mega mall, no, we're testing in 20 malls of Robinson. We're testing in practically all SM. We're now testing with Pure Gold. We're also testing. We're making arrangements with all these para madali makatest. Dahil pa, gusto ko rin umandar yung business, di ba? pag mga may testing doon, may incentive sila magpa-test. But really, what we need to do is get the people to know that they need to be tested and they have to be tested. Number one yan. You have to separate yung mga may sakit sa loob ng barangay. Kung di mo masa-separate yung kakalat na kakalat, we're seeing, sabi sa akin ni Vince Dizon, kumisan sa isang bahay dati, isa lang ang nakakasakit. Ngayon, 4, 5 may sakit. So yun ang dapat natin atupagin. Anong gagawin natin doon? Kung magka-quarantine sila doon, dahil pare-pareho na sila may sakit at wala namang grabe, magbibigay tayo ng pagkain para alam ng tao, inaasikaso sila ng gobyerno, hindi sila inaabutan. Concern lang ang gobyerno at masasabi natin tumulong na sila sa pagsabi sa kapitbahay. But you see, hanggang hindi natin tinuturo sa tao yung sense of urgency, I don't think we've done enough because mababa talaga dati. 4% lang nga kami dati, nagugulat ako eh. Pero bigla nga ito, bumuluwak ngayon, 11% na. So naniniwala ako na talagang tataas talaga yan.
Okay, we need to take another short break. There was a hearing last week on the raid in Calabarzon where 9 activists were killed. This was headed by Senator Richard Gordon. We're going to talk about that after the break. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. Our guest today, Senator Richard Gordon. Senator, I believe it was last Thursday, there was a hearing on the, what is called the Bloody Sunday raid. I saw parts of that, and I do remember General Ferro saying that in those raids, meron po sila nakuhang about over 30 firearms and over 10 explosives. And then I also spoke to Congressman Eric Colmenares and he said, walang ganon. No such thing happened. In fact, ang nangyari, yung mga pulis pumasok sa mga bahay, na-seize na daw nila, na-control na yung area, pinalabas daw yung mga pamilya, allegedly, sir, and then bigla na lang daw may narinig na mga putok. What is your sense o yung sa nangyari po dito sa Calabarzon?
Dahil ang search warrant malinaw. Kukuha ka sa court. Tama si Justice Hesmundo of the Supreme Court. Mag-ingat kayo sa pag-i-issue ng search warrant dahil binabalasubas yan. So, ang nangyari dito, they had overwhelming force. Marami silang baril nasa labas. Hindi naman pumuputok sa labas, sa loob. Bakit sila biglang magpapatayan sa loob? Hindi naman ganun ang sitwasyon eh. Dapat may negotiator na yan. Pag napaliguran nyo na yung bahay, you now go in the negotiator. Lumabas na kayo. Papasok kami dyan. We don't want anybody to get hurt. Ano nangyari? Pumasok. Yun, patay kagad. Ang dami-dami. Pero hindi lang naman yan Pinky. There is a crime wave. I've been investigating the riding in tandem. Siguro mali ako doon na sinasabi ko riding in tandem. Ang gusto ng iba, extrajudicial killing. Yun na yun talaga namang ang dami-daming pinapatay. Sa lawyers lang, about 91 have been attacked. Sa 73 have been killed. Since January. Ano ba ang gusto natin sabihin? May parang crime wave. Yung mayor, doon sa kinalakay ko yan doon sa hearing ko last week. Bakit si Mayor Aquino, ang una sabi nila, in-ambush. Tapos pangalawa, nag-encounter Pidea. Tapos pangatlo, nagkabaliro, misencounter. Parang they can't shoot straight, they can't investigate straight. And to my mind, there are some people in the police department that have to be arrested already because they become rogue. Nasanay na silang pumatay na hindi sila nahuhuli. Kailangan mahuli lahat sa mga yan.
At bakit ho sila? Why is there that yung pakiramdam na nasanay na sila na pumatay?
Alam mo kasi wala nangyayari. Wala tayong nakikita nakukulong na pulis. Ang nakita lang natin si Juan, itong pumatay dito sa Tarlac. Anyway, yung pumatay sa Tarlac na yung babae. Pero ang daming napapatay, they get away with it. And once people get away with it, dadami at dadami yan. Yung Mayor Halili, binaril, sniper. Yung Mayor ng Los Baños, binaril. Ang dami-dami, hindi na bali. Mayor, abogado, judge, walang pinapatawad. May hirap na tao. Ang nakita lang natin na kulong ay sinuwes ka dahil may CCTV. Pero anong batting record nila sa investigation? Ang problema nila, pag may nahuli silang person of interest, sabihin nila, case solved. No, the case is solved when you finally put people behind bars. We don't see that happening. And dapat ang presidente talagang batukan na sila, sabihin tanggalin ko kayo. The salary of a policeman, and I'm very, very pro-police because they're the only ones that will protect us. But upon the other hand, if you're paid 30,000 starting, ang teacher 19,000, maghunos dili ka naman. Gumalaw ka naman. Pero ang nakikita ko, ang dami talagang nangyayari na pinapatay mga doktor, mga mag-asawa, mga babae pinapatay. Saka yung sinasabing red flagging, that's on both sides. They say red flag, communist kwan. Wala nang communist eh. Hindi na bawal yan eh. Pero dapat, gawin nila na, excuse me, na dapat sila ay yung investigation aspect.
Yeah.
That's why you have courts. You cannot be judge, jury, and executioner.
All right. Senator, naubos na po yung oras natin. I'd like to thank you for your time. Thank you, Senator Richard Gordon.
Thank you, Pinky. I hope that was
Very enlightening conversation, sir. Thank you.
Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.